Welcome to Prime Life. We call it Retirement 2.0. Leave each episode with tips and new ideas to help you navigate retirement in our new age. It's your time. Make it count.
This podcast is for educational purposes only. It is not intended as medical, investment, or financial advice. We do not sponsor or endorse any of the individuals, companies, products, or services featured on this podcast. Any statements or opinions expressed are of the individual who makes them. We hope you enjoy the episode.
Hello, everyone, and welcome to another episode of the Prime Life podcast. This is your host, Joseph Katz, here again with my co-host, Mary Crean, who is always a pleasure to spend time with. Mary, I know we have a great show lined up. How you doing? And then would you do the intros once we catch up real quick?
Well, I'm doing quite well. Thank you for asking. It's always great to see you, Joseph. And we have a very interesting guest today, so I'm going to jump right in. He's told me I can call him Danny. I love that name, Danny. Danny Rudyak. He's a serial entrepreneur, which we love those, right? Who began his career in investment banking and private equity, completing over $1 billion worth of transactions. Wow. His deep personal experience, which you're going to hear about with healthcare, inspired him to co-found ReadyRx, a national longevity and wellness platform, democratizing access to life-changing therapies and preventive healthcare. Danny, welcome to the Prime Life podcast. Tell us a little bit about yourself and what you're up to these days.
Mary, Joseph, thank you for having me. I would say that these days, I think that we've been diligently working on this for several years now, but subsequent to my experience with private equity, I really wanted to do something that I built, be involved in something that I built from the ground up and really cause for an impact. I had a lot of experience being inside the weeds with a number of different types of businesses, but those were existing businesses that we bought, owned, fixed up, operated, and sold. But building something from the ground up is just a complete other level of rewarding for me personally. So, to your point, I'll take a step back and say I've been very curious about healthcare since a young age. My father was diagnosed with multiple sclerosis when I was 12 and had a yo-yo experience with lung cancer where he was diagnosed with metastatic lung cancer. They operated on him, told him that he's got, 5 years. If he's in the clear for 5 years, then he'll be fine. And 5 years later, nothing kind of came around. And half a year after that, he was metastatic again. So that was, the first in the series of yo-yos. He underwent a pretty rigorous treatment with chemotherapy and got on some experimental drugs. They told him that everything that he's doing is just a function of maybe elongating his time with us, but it was too far gone. And back in 2015, I remember going into his oncologist's office with him and reviewing a set of scans where they were in utter misbelief. They said, it's stopped growing, it's going backwards, and this is your new lease on life. So that was an incredible shock, right? It was one of the most positive shocks I'll ever experience in my life. And about a month after that is when he passed away. So it was definitely very challenging having such a roller coaster of emotions. But that was my first real experience with healthcare where mortality was at play, right? I had my own experiences prior to that. But about 3-4 years ago, my now fiance and soon to be wife was experiencing another health incident where she was misdiagnosed by 2 leading hospitals in Los Angeles, which is where we live. And I was very close to losing her. And it was just because of subjective reasoning, right? And I think at that point, we got very lucky that she's still with me and we had to advocate for ourselves, but that was kind of the straw that broke the camel's back, and decided that I really needed to do something and be involved in reforming healthcare as we know it. Started the journey to building ReadyRx. And fundamentally, we're taking a proactive approach to health and wellness as opposed to reactive. Or I think fundamentally, as you guys know, our healthcare system is built on you get sick, you put a Band-Aid on it, as opposed to why did you get sick in the first place and how do you prolong health and how do you educate yourself, right? It costs a lot less to stay healthy than get sick later on. And that's what the system gambles on, is they profit from illness. Unfortunately, that's kind of where we've evolved over time. And so we wanted to be a part of the change. And so we partnered with a large group, hundreds of physicians nationwide, like you said, all 50 states, and started offering scientifically backed, pharmaceutically dispensed therapies from supplementation that's actually bioavailable to medications that can help extend and prolong your life. And we continue to offer personalization for each customer and help them really understand the consistency importance of taking care of themselves and building healthy habits. That's kind of fundamentally what our mission is.
Quick clarification there for me. Is this a supplement nutraceutical type of a business, or is it something more sophisticated?
Yeah, I mean, there's nothing currently that you can get through ReadyRx that is not doctor prescribed and dispensed by a pharmacy. It does include therapies that are otherwise not bioavailable. What does that mean? It means that your body can't absorb them, metabolize them. Things like B12, which you cannot orally take, or NAD+, which is a very large molecule. Your body naturally produces it. It depletes. It is the fundamental driver of your energy in your body. It controls the mitochondria. And those molecules are too large to be absorbed orally. So there are injections or nasal sprays that are all rigorously tested and dispensed by a pharmacy with a prescription.
Sorry, I have to jump in. B12, which people buy by the bottle, in big box stores and drugstores, you're saying that popping all those pills is pretty much useless?
What I'm saying is you see the results of that, right? Like you could take as much of that as you want and look no further than your toilet bowl to see where it goes. There are certainly, I don't want to make a blanket statement to suggest that every single vitamin is not bioavailable orally, but I can certainly attest that the overwhelming majority are not, right? So the absorption and quantity of the actual vitamin that your body takes in.
Well, because I know B12 is one of those vitamins that pretty much everyone has some deficiency in because your body doesn't, I guess, process it properly. I didn't realize that was the issue. But
well, so vitamin D as well.
Vitamin D. I'm going to let Mary go for.
What are the treatments that your company is able to democratize for those who cannot access? Maybe you can take a step back,
sure,
and help us understand what that all means and why it's so important.
So I guess I'll take a step back and say what a typical customer's experience is like, right? They'll usually do some research, understand that they're interested in something, whether it's methylated B12 or NAD or glutathione, which is our body's master antioxidant. There are a number of therapies, but they'll express interest and go through a doctor intake. From there, they have either a video or messaging-based conversation with the doctor, and the prescription will be written. We then call and ensure that everyone understands what they're getting, understands what best habits are, best practices. And that's a function of everything that we do is mentorship at the clinical and peer level and help build healthy habits, right? So even if you get nothing more than this, it is fundamentally the most important thing you could do is build healthy habits around your life. And that includes, clinically, whether it's 7,000 steps a day tied to 50 to 70% lower risk of death compared to less than 7,000, or 7 to 8 hours of sleep a night is linked to 24% roughly lower risk of all-cause mortality. The basic things that you can do and educating people around healthy habits is important. We're also launching in partnership with two of the major lab companies in the nation, labs to help people understand their genetic biomarkers and understand what an optimal stack would be, right? Whether it's supplementation that's bioavailable or otherwise. And so there's a lot that goes into it. But in terms of democratizing it, it's as simple as this. These were therapies that we all really wanted to take. But when we understood how to access them, it was through these wellness spas and med spas, right? These spas are generally not FDA regulated. There's generally no doctor involved, and there's a lack of clarity as to whether or not you're getting a bag of saline or something true and tested because there's no regulation. And for a single session of glutathione or NAD, just a singular session can cost upwards of $1,200. Whereas we're talking about having those same therapies, not for a session, but on a monthly basis with access to unlimited interactions with doctors and coming directly from a pharmacy that lab tests, potency tests everything in the United States for $200. That's the democratization, right? Is like, how do you get access to not only the suite of services, but a high quality product at scale at a 90% discount relative to what is otherwise available.
That is amazing. Yeah. So just to clarify, everything you do is FDA, under the FDA umbrella in some way or another?
Great question. So for example, B12, so FDA, the way that they approve medication, it's for a specific diagnosis, right? So B12, for example, there's no specific diagnosis, or NAD plus, a doctor wouldn't say you're aging and I'm going to, for that reason, write you a prescription, right? You're depleting in this NAD. It's a supplementation of a naturally occurring molecule. So there are FDA treatments without a doubt available on our platform, but furthermore, there are effectively supplements, whether it's vitamins or molecules that naturally occur. They come from FDA regulated large compounding pharmacies, but they themselves are not FDA approved for a specific ailment.
I'm not sure. I follow for the most part. So someone comes in, let me clarify right there. Do they come in, or is it all telemedicine?
Everything is telemed and shipped directly to your house.
Okay, so telemedicine, and you say you meet with the doctor and they say this is what you need. Some of what you need may be an FDA regulated pharmaceutical, and some might be a nutrition supplement.
Sure. For example, hormone therapy is FDA regulated, or for example, sermorelin was FDA approved as a growth hormone mimicking like peptide, right? Or metformin. These are technically FDA approved for certain diagnoses, but we also have pharmaceutical dispensed, lab tested from the same pharmacies that are all fundamentally FDA regulated supplements, molecules, and vitamins that are delivered injectable or nasal, what have you, that go through rigorous testing. So it's a combination of the two.
Can you take us through the process? So I'm interested, I want to become a new customer. What does that look like? What's the first step, second step, et cetera?
And we'll get that answer after a brief word from our commercial sponsors.
Nassau is always working harder to be your carrier of choice. We offer insurance products that can help you meet your retirement goals, such as protecting your savings, securing lifetime income, or paying for healthcare costs. We're dedicated to providing best-in-class service and are keeping things simple, and we'll have your back. We have around 400,000 policyholders and contract holders and have been doing this for a long time, 170 years, but we remain humble enough to always try to improve. For more information, visit nfg.com. Nassau insurance products are issued by Nassau Life and Annuity Company of Hartford, Connecticut, Nassau Life Insurance Company, East Greenbush, New York, or Nassau Life Insurance Company of Kansas, Overland Park, Kansas. Subsidiaries of Nassau Financial Group. Products are not available in all areas. Policyholder counts are for all Nassau companies as of September 30th, 2022, and are subject to change.
Yeah, I mean, you start at ReadyRx.com. You see all the various therapies. You learn about them on our website, high level, and you might choose to do additional research, or you might have already heard about that therapy. You'll see pricing, and you'll simply click Get Started. You'll answer a couple of questions, and then there's a checkout experience, and you get linked with a doctor where a prescription is provided and a conversation is had. It's really that simple. It happens in a matter of minutes. We aim to have a doctor match within 24 hours. Obviously, if you come in on a Sunday, there's going to be variability. but that's our goal, is call it 24 to 48 hours. Then the pharmacy actually compounds personally for each patient by prescription. So that takes anywhere between 2 to 4 days, and then it's shipped overnight by UPS directly to your house. And then it's a subscription where you can choose to pull it forward, push it backwards, keep it on the recommended cadence. But once again, I started this by saying consistency is everything. And I think that's hopefully one of the more important lessons in anything that we do is consistency is everything. You don't see, there is certainly a marketing misconception. You take a pill, take this one pill, and you will live 180 years. That's not a reality.
No.
Now, with AI, might that be a reality in 10 years? I can't speak to that. But our current reality is very much not that. And anyone who tells you otherwise would be lying to you. It is a combination of healthy habits and a combination of consistency and caring about yourself and willingness to want to make a change. That's what
go ahead, Mary.
No, I was just going to say, I mean, it's like exercise. Oh, I want to look better. I want to work out once or for a month, and then I'm going to stop. Well, it's not going to continue for you.
Revert back to the mean is kind of always the thought.
Yeah.
I'm going to add a little to what you just said, because years ago I worked for a ad agency, and we were promoting a prescription medication. And one of the hardest things for that prescription medication company was the consistency, and for you to see the efficacy of the prescription, you had to consistently use it. And so people would see an immediate response, and then they would stop. And what happens then? The results drop. So yes, 100%. If once you sign up for a protocol, stick to the protocol. I just want to ask a clarifying question to your earlier answer to Mary. So everyone gets a prescription regardless. I self-identify what I want. Is that how it works?
I mean, there are clinical reasons why a doctor might choose to not prescribe it to you. But correct, especially with a pharmaceutical dispensed vitamin or molecule, there's tremendously high likelihood that you'll qualify, right?
There's low risk.
It's generally, cancer or something like this that would be, it doesn't suggest that it's not a suitable therapy or protocol for you. It just suggests that perhaps in a telehealth capacity, our doctors don't feel comfortable treating folks that might have active cancer with specific therapy.
So you have to fill out a real medical profile. So
absolutely,
I'm taking these prescriptions, adverse reactions.
100%. And I go back to what I just said and say that one of our advocates, it was really inspiring to hear this. One of our advocates was on a TikTok live, 2 weeks ago. And it was one of my first interactions just watching her on that live. And she spoke about how a doctor, she was going down a metastatic bad place with her cancer. And she was speaking about how, nothing was working. And one of her doctors actually recommended NAD+ for her at that time as something that could potentially help because DNA damage and repair is certainly linked to the depletion of NAD in our bodies as we age. So once again, I reiterate that it's not that these therapies aren't good for you and perhaps very good for you if you're ill. It's just there's a right way to do it, and telehealth might not, for the time being, be the right avenue for certain instances.
So I love that you shared that story, because I think that's a great example, because it's not one size fits all. And I think, like Joseph said, inputting your profile of your situation, your health situation, is obviously important. So this whole concept is amazing. I admit I didn't know about it. Where do you see this whole health and wellness trajectory going in the next 5 years, for example? I know 5 to 10, but let's talk 5, because 10 is really far out.
I think that I certainly won't get political. I take a pretty centrist stance across the board, but I think that there's enough frustration in the system now where there are a lot of questions surrounding the revenue generated by the FDA and then how biased or unbiased their decision-making process is. And I think there's a lot of education that's coming about, with plastics, right? They've done some interesting studies where people have drank water out of plastic bottles their whole life, and using a male example, they found the equivalent of a credit card of plastic in their testicles. And what does that mean for fertility rates? What does that mean for health? And so I think that we've kind of made some, for the time, we did the best that we could in the 90s and 80s and early 2000s. And now we have some more information with some 2020 hindsight as to things that we can change. So I think about this in a different ways. My dad died under the age of 65. If he was born today, could he live another 30, 40 years? And I think without a doubt, the answer is yes, right? I think in the next 5 years, we just move more towards personalization, more towards information. And I think there's enough of a zeitgeist and revolt around the crappy, cost-effective food options available to us, because it certainly starts with food, that I think there's just a tremendous shift. There's no reason why the United States needs to have the most unhealthy population out of any first world country. So I think that we're moving towards personalization, innovation. I think AI will continue to unlock tremendous innovation in cancer, certainly. And yeah, I'm excited about the direction that we're going over the next 5 years.
So you ready for the big democratization question?
Go ahead.
So the medical industry, the industrial complex, insurance companies, doctors, lawyers, blah, blah, blah. I think one of the challenges for medical startups is that everyone is paying for medical insurance. So does this qualify, A, for like flexible spending or health spending, and B, will it ever be covered by insurance if it's not already?
So we do take FSA and HSA. We do. We also have, you've seen, I think it was last week or so, Klarna IPO'd. There are a lot of these pay over time, which allows us to actually offer kind of 3 or 6 month plans that are more discounted, where you're committing to consistency. And in partnership with these pay over time, you can really break out these payments at 0% interest if you qualify. With that said, I think as soon as you see a GNC B12 supplement covered by insurance is as soon as you see a pharmaceutical dispense one. Right? I don't think that insurance currently is interested in, at this time,
No, they're not. It's
investing in preventative health.
Right?
That's not their modus operandi at this time. Do I hope for tremendous change in what's covered? Right? Like we also see it. We carry both branded GLP and non-branded GLP-1 products. And the non-branded only for people where they qualify for some specific medical reason. But that's a fundamentally life-changing product, in that we have a tremendous obesity epidemic. And it's very clear that these medications work. And I would love nothing more than everyone to be eligible, but they're not. And I think that's, to your point, that's an insurance problem. And I don't know, they're so regulated. I think it all comes down to, it's not even the insurance companies, it's the intermediaries, which are the PBMs, the pharmacy benefit managers.
Oh, yeah. No. That's what I'm saying. This is an industrial complex of so many layers.
Yeah.
But I think that the biggest challenge is that people realize I'm paying so much money for my medical insurance. I can go to the doctor for free or $20 or whatever, and they'll give me some prescription that may cost me $20, $30, $50, whatever that is. Mm-hmm. Why would I pay $200? If using your earlier example. So I think I'm guessing here, right? I'm guessing your customer base, at least right now, are early adopters, people who are more aware of their medical situation and are fighting the fight for themselves versus relying on doctors. I mean, you can tell me if that describes.
So we definitely have a healthy insured population, and candidly, very diverse socioeconomic backgrounds in our customer base. And there are people, I'll give you a really funny example. So I know you guys are both on the East Coast. There's just a members club that just opened up in New York called like the Kith Padel Club or something to this effect. And they did a joint venture with a grocery store in Los Angeles called Erewhon, which has been blowing up. And it's all over. Are you familiar?
I love Erewhon. I've been going to Erewhon for 30 years.
So Erewhon is a great example of this. You have people spending their rent money on groceries at Erewhon, right? So it's a decision about how you're allocating your money. Like, you could likely get organic products outside of Erewhon for a fraction of the price and still have enough money that you would otherwise spend on other luxuries on investing in yourself. And for some of our therapies, there are pretty instant feedback loops. We're talking about waking up with more energy where you otherwise didn't have it, clarity of thought, addiction reduction. So it's not just, there are certainly therapies that, with time it builds up and you just see it by getting less sick less often, right? But there are some that have pretty instant gratifying feedback loops as well. And for that reason, we have folks that are willing to pay that. I mean, if you think about my insurance, I take our NAD. My insurance is many multiples of our monthly NAD, and I get access to a doctor. Now, for example, I use a hospital system that's a major hospital system in LA. When I message my doctor, even with insurance, that's $75 a message to my UCLA doctor, whereas you get unlimited communication. Like, put a value on that. You get unlimited communication with a doctor and or their staff. You can put that into your budget for what a therapy would cost.
I'm going to jump in here. I totally agree with what you were saying about, I think it's priorities and investment,
Exactly.
like in yourself. And I get that, if you don't have the money, you don't have the money. When it comes to exercise, if I know people that have plenty of money and they won't pay to go to a gym, which I don't get that. Or just about quality of food. Growing up, we didn't have a lot of money, but food was a priority. My mom, she's from Sicily, immigrated here. We didn't have a lot of processed foods. Of course, it was easier back then, but food was always a priority. And even though my parents didn't have a lot of money, it was a priority to try to get the best foods possible. And, that's what we had. But I do think in life, right, we prioritize what we want to spend our money on. There's so many things that insurance that doesn't cover anyway. That's a whole other episode.
I think we mentioned that because putting all of the intrinsic health value in the GLP product as an example, and or the additional services you get from the program, the average customer about 2 months into their therapy on GLP-1 as an example is making up 80% of the cost of that therapy with reduction in food costs and or alcohol, because it triggers that same part of the brain that is craving something, right? That's how it works fundamentally. So there's a balancing act too. When you're feeling healthier, you have less negative cravings and willingness to spend money on maybe worse things. So there's this interesting feedback loop where there's actually return on your investment when you think about living a healthier life. The gym is a good one too, right? You don't need an Equinox membership. Go and run walk 7,000 steps, like I said, ensure you're getting the right sleep, do some push-ups. There are ways to be crafty, should you choose to.
It's a priority, absolutely.
So I was going to actually, I beat up the industrial complex. And now it's before Mary kind of gets to our last question of the show, because this could go on for hours probably. But we've seen over the last number of years, insurance companies are starting to add in benefits that, tilt towards wellness, right? So, they offer $100 credit for a gym. I know a lot of Medicare plans have gym memberships built in. So they're starting to realize that, hey, if we keep people healthy, maybe they won't need as much medical care. So we're not there yet to where it needs to be, because in theory, if you're buying organic food and, taking, wellness not drugs, supplements and whatever the right word is there, and you go to a spa to relax and de-stress, those things should all count towards your overall health, right? So it's just interesting. I think it'll change over time, but it's not there yet. We're far from it.
I think because, to your point, also just employers are doing the same thing, right? So to retain their customers, to keep them healthy so that they're coming to work, so that they're more engaged, so that they have clarity of thought, they're also offering these benefits, to your point, because it also translates not only to retention, but higher productivity for them as an employer per full-time employee.
And I'm just going to add this in, and then I'd like to get your final thoughts, Danny. So Nassau Financial Group, who I work for, we have a fitness center manager, Mike. He's been on Prime Life podcast. We have a strong health and wellness ethos in the company. It's not just lip service. We offer employees a lot of different options. So again, it's you don't have to go to the gym and lift the weights, do the treadmill, but there's something that you can do. I believe at Nassau, they try to teach that. And it's one of my favorite things I like to do as part of the health and wellness committee. We meet quarterly, we talk about it. And so I think it's just when you kind of lean that way. And so it's inspirational, but it's also, I always call things like this my lifeline. But we're not talking about me today. So I'm going to go over to you, Danny. Do you have any final thoughts before we
Before I
ask
get to
you
my
the
final
final
thoughts,
question?
I did want to say that, how powerful what you just outlined is, because going back to consistency, everyone needs a little push every so often, right? So having that core system, whether it's your employees or someone within the organization, that would continue to motivate you and tell you, like, it's one more step, right? And keep you on your the right track to health and wellness. I think that's what a lot of people are missing. And for companies and organizations like yours that offer that, I think that's one of the most incredible benefits that you guys offer. We aim and strive to be the same way at ReadyRx by providing mentorship and consistency and support and availability to know that, you're not on the health and wellness journey yourself, and know that you can always have someone to really be there to be your support system and keep you motivated. So the fact that you guys do that at Nassau is pretty remarkable and incredible. Closing remarks, I think I really echo what Joseph said. Like, we fundamentally could probably have this conversation for another 4 or 5 hours. So I'll take it wherever you want me to take it, guys.
Well, we'll probably have to have you back, Danny, because we also want to get an update on the progress that your company's making. But do you have any final thoughts for our audience, like a couple of takeaways that they could really contemplate or even perhaps take action on?
Yeah, I would say, once again, where I started, simple things, consistency, keeping yourself accountable, and building habits, right? Habits are learnable. It's just, you have to decide that today is the day that I'm going to make a change, and then keep consistency. So to that end, definitely the biggest thing that you can do if you make one change is sleep, right? Getting your 7 to 8 hours of sleep will change your life.
I agree.
Prioritize that. Prioritize, you don't have to run, but 7,000 to 10,000 steps a day. And if you're in an office, you can pace and get on a call. And I do that all the time. Figure out a way, stop making excuses and figure out a way to think about what you eat and know that it all starts with the gut and the food that we're consuming, and question what it is that you're eating, and think about, how do I avoid getting sick, as opposed to what protocol and safety do I have in place after I get sick. This is very much something that is in your hands, and it's just a bit of retraining the way that we've been thinking over the last several decades that leads to a much healthier population.
I agree with that too. It's breaking this early education that you have to take prescription medications for every problem. But again, well, that could take us into a whole another world. So before we wrap up, Danny, what's the best way for someone to get in touch with you or learn more about your company? And Mary will put everything into the show notes, but for those who are just listening.
Absolutely. So ReadyRx.com, as it sounds, ReadyRx.com. There is a contact us form if you have any questions. Also, you can just email us, info@ReadyRx.com. And even if you're just swinging by to learn more, I highly recommend that. We love to have a growing community, but from a mission perspective, we just want to educate people. That supersedes anything. So whether or not you get it from us or someone else, we want to be a part of your family and community, but the education comes first.
Amazing.
Yeah.
Well, thank you, Danny. This was a really great conversation, Mary. I hope you enjoyed it as much as I did.
Oh, I absolutely did. This is one of my favorites, and I think we're going to have Danny on, but we're not. Before we let Danny go, though, Danny, I read your background. It's tremendous. You can do whatever you want at this point in your life. Why do you wake up every day and do what you do with ReadyRx?
That's a great question. Look, I think it took some time to get to where I am. Being an entrepreneur, especially later in life, where you have a mortgage, property tax responsibilities, can be very difficult. And most entrepreneurs, if they're doing the right thing or they're tackling a big enough challenge, they'll financially be put in a position where their back is against the wall. And perseverance is, I think, one of the most important things. But once you, for me personally, once I started getting that feedback loop of hearing how we're changing our customers' lives, how they're actually, weaning off of ADHD medications, or they're no longer feeling the addiction to nicotine that they used to, or they've lost 80 to 100 pounds. These things that might seem small and minuscule, hearing these, I think, is very emotionally rewarding. And, that's why I wake up every day and try to push the envelope and continue to innovate and provide the best service that we can, is hearing that we're actually tangibly impacting lives. That's the most important thing.
I love that. Joseph, you want to?
Can't get better than that, impacting people's lives. Thank you both. It's been a really great conversation. Check out ReadyRx.com for more information about Danny's company. And until next week, thank you for listening. Give us a high five, thumbs up, like, whatever platform you're on, share wherever you're seeing this. We'd love to hear from you, and enjoy, and we'll speak to you next week. Have a great one, everyone.
Thank you.
Bye, everyone. Take care.
Remember to subscribe to the Prime Life Podcast anywhere you find podcasts. You can find all of our episodes, contact information, and more on our website, primelifepodcast.com. Stay connected with us. Follow us on LinkedIn, Instagram, Facebook, and TikTok.